Have you ever wondered why young Indians who are apparently healthy are having heart attack at such an early age? As a practicing cardiologist, I tend to see patients who are in their late 20s and early 30s having a heart attack. Most of them, they do not have conventional risk factor like high sugar or high BP or high cholesterol or obesity. But one risk factor is very common among them, and this risk factor is usually overlooked, usually ignored both by the patients as well as by the doctor. And we'll talk about this dangerous risk factor, which is belly fat. We'll discuss today what is the role of belly fat in heart disease and heart attack, how to assess belly fat, and how to prevent belly fat. We as a South Asians, be it Indians or Bangladeshi or Sri Lankan or Nepalese, we have higher risk factor for heart disease. We have 4 times more risk factor for heart attack and stroke compared to our Western counterparts. And we tend to develop this disease much earlier, at least a decade earlier compared to our Western counterparts. Usually it is thought that since South Asians have a higher population, that's why you tend to develop, we have a greater burden of heart disease. But that is actually not true. Although we have a higher population density, but our population is 20% of the global population, with India contributes around 1.5 billion people on its own. But the cardiovascular the magnitude or problem is 60% of the total global problem. So India and South Asians, they have a disproportionate cardiovascular disease compared to their population. We as Indians, we tend to develop heart disease at much earlier age. It is estimated that per year around 30 lakh people develop heart attack, and out of this 30 lakh people, around 2.5 to 3 lakh people die annually because of heart attack. And most of this heart attack and death happens at an early age, around 30 to 50, when the person is the breadwinner of the family, and when they succumb to their illness, they leave behind their family with the young children and wife. So that's why it is important to know what causes this early heart attack. There had been multiple studies where we had assessed what causes the early heart attack in Indians and South Asians. And most recently, the study which was undertaken to know the risk factors behind early heart attack and heart blockages in Indians and South Asians was the MASALA study. The MASALA study was a study which was conducted especially for the South Asians who are living in the USA. And they have assessed what are the risk factors, and they have assessed this risk factor over a period of time and seen which risk factors are very common among this South Asian population. And they have found this South Asian population, they develop heart disease at much earlier age compared to their Western counterpart. And one of the most common risk factors the South Asians have, although their body weight might be normal, is belly fat. South Asians tend to develop belly fat at an early age, and this contributes to early onset of heart disease. So we will discuss today how belly fat contributes to early onset of heart attack. So fat actually can be different types of body fat. Most of the time we assess fat which is basically subcutaneous fat, which is present beneath the skin, which you can pinch with our fingers. And these subcutaneous fats are present under the chin or around the neck region, in the arm or in the legs. So this subcutaneous fat, they may be cosmetically not very appealing, but they are not very harmful. But the harmful fat which are hidden inside the body organs, those are known as visceral fat, are very, very dangerous for our body. So these are hidden dangerous fat which is wrapped around in our organs. Like this fats are present inside our body organs, around the heart, around the liver, around the intestine, around the kidneys. And this type of body fat, which are known as visceral fat, are very, very dangerous for our blood vessels and heart. So very commonly we assess our body fat as healthy or unhealthy depending on BMI. The BMI stands for body mass index. And how to assess the BMI? We can easily Google it and see. To assess the BMI, actually you have to have 2 parameters. One is body weight and one is height in meters. So with these 2 parameters, we can calculate our BMI or body mass index. The normal body mass index is around 18.5 to 22.9, in that range. From 23 to 25, it is overweight, and if it is more than 25, it is considered obesity. So for an ideal BMI should be around less than 23 for an Indian perspective. So suppose my body weight is 74 kilo. My height is 182 centimeter. So my BMI would come around 22.4. For the same height and for the same weight, consider an Western person whose body weight is also 74, whose height is also same 1.82 centimeter, 1.82 meter. His BMI also would be around 22.4. Same body weight and body height. But since I am South Asian descent, although my BMI is in the normal range, but still my visceral fat, that means the fat around my body organs, will be higher compared to a Western person. So Western person will have higher proportion of subcutaneous fat, but with Indian person or South Asian person, they tend to develop more visceral fat or more abdominal fat with the same body weight compared to a Western person. So as a South Asian, as an Indian, we need to be more cautious. We need to keep our BMI as low as possible, less than 23 to be optimum, because we tend to develop visceral obesity, that is fat around our organs, or abdominal obesity at much lower body weight compared to Western individuals. So how does belly fat cause heart attack or heart blockages? Through multiple mechanisms, belly fat can cause heart blockages or heart attack. One reason is with the accumulation of belly fat. These belly fats are quite toxic, and these fat cells, they are actually active cells, and they secrete various molecules, and these molecules are known as cytokines. And these cytokines are basically chemical mediators. They go into the circulation and they damage the blood vessels, especially the tiny blood vessels of the heart. Through that damage, they can cause blockages. So first is belly fat causes release of various chemicals which are known as cytokines, which leads to damage of the blood vessels. Second, because of the accumulation of the belly fat, our body becomes resistant to insulin. So our body becomes insulin resistant, and this high insulin and insulin resistance also contributes to blockages of the heart vessels and premature blockages or heart attack. Third, because of accumulation of belly fat, there is an unhealthy lipid accumulation. There is elevation of triglyceride in our blood, and triglyceride makes our blood thick. So as very commonly we tend to see in our patients, those who had a heart attack, most commonly their triglycerides are very elevated and their HDL or good cholesterol is very low. So these are the combination we usually commonly see in our patients who had a heart attack or who had a heart blockage. Their triglycerides are high and their HDL is low, and very commonly this ratio is more than 2:1 or more than that, 3:1, sometimes even 10:1 also. Ideally, this triglyceride and HDL ratio should be as close to 1:1. But very commonly our patients, some of them have even more than 10:1, the triglyceride and HDL ratio. And fourth, because of the accumulation of body fat, they have a higher blood pressure, and higher blood pressure also contributes to coronary or heart blockages and early heart attack. So because of these four mechanisms, belly fat causes premature heart attack and heart blockages, because they release cytokines, which are chemical mediators which damage the blood vessels. They causes insulin resistance and high insulin in the body. It also causes blood vessel blockage. Third, they have a higher triglyceride and low HDL. And fourth, because of high blood pressure, also all those mechanisms contributes to premature coronary artery disease or heart blockage. So in MASALA study, they have found those South Asians or Indians who have a belly fat, they have a more calcium in their coronary arteries on CT scan. They have done a CT scan of the heart, and CT scan of the heart showed that their blood vessels, the tiny blood vessels inside the heart, they have a high degree of calcium. So normally calcium should not be present into the blood vessels of the heart. Calcium should be present in our teeth as well as in the bone. There should not be any calcium in our blood vessels. Whenever there is a calcium in our blood vessels, especially blood vessels of the heart, it indicates the blood vessels have become stiffened and there are blockages. So presence of calcium on CT scan in the heart vessels indicates there are damage to the blood vessels of the heart and there are indirect evidence of blockage in the heart. So in the MASALA study, they have shown that South Asians, they develop belly fat at an early age, and those who are developing belly fat, they tend to develop a higher degree of coronary calcium, which indicates they have a higher degree of block in their coronary arteries or heart arteries, and it is directly proportional. That means the higher the belly fat, the higher coronary calcium they have, and they develop premature belly fat, and consequently they develop premature coronary artery disease or blockage in the heart vessels. So having known that belly fat is extremely dangerous risk factor for our heart, especially it causes premature heart attack and heart blockages by all this mechanism as we have discussed. So if you have a belly fat, you should take note of the fact that you should be able to assess how much belly fat you have, because assessment, unless you assess it, you won't be knowing that whether you are having a belly fat or not, because by visual inspection and by assessing your BMI, you cannot say whether you are having a belly fat or not, because BMI or body mass index tells the degree of overweight. It tells the amount of body fat in your whole body. It doesn't tell where is your fat, whether your fat is accumulated under your skin or your fat is accumulated inside your organ, which is the visceral fat, or into the abdomen. So in order to assess whether you are having a belly fat or not, which is extremely dangerous, you need to assess how to assess the belly fat. And this assessment of belly fat is quite easy. In fact, you do not require any fancy gadgets, nothing is required. Only one thing you require, which is very easily available, is a measuring tape. So you take a measuring tape and you assess your waist circumference, and you assess your waist circumference around the level of navel, midway between your lower part of the rib cage and upper part of the hip bone, around the navel, and you check the circumference your abdomen. And for the male, it should be less than 90 centimeter, and for the female, it should be less than 80 centimeter. If it is more than that, that means you are having a visceral fat, you are having an abdominal obesity, and you need to take preventive measures, because unless you take a preventive measures, it can cause lots of complications, as we have discussed previously. So one is checking the waist circumference. For male should be less than 90, for female should be less than 80. Next, you should check the waist hip ratio. Now waist, you know how to measure it at the level of navel with the measuring tape. Second, you check the hip circumference at the widest portion of the hip, and you see the ratio. Suppose your waist is 92 centimeter and your hip is 100 centimeter. That means your waist hip ratio is 0.92. So for male, the waist hip ratio should be less than 0.9, and for female, it should be less than 0.8. That's how it should. So for male, it should be less than 0.9. So if it is your hip is 100 centimeter, your waist should be less than 90 centimeter for males. And for female, if it is hip is 100 centimeter, your waist should be less than 80 centimeter. So these two things you can easily see at home: the waist circumference and waist hip ratio. This will give you an indication that whether you are having a belly fat or not. There are other advanced modalities to assess whether you are having belly fat or not. Like you can do a CT scan, you can do an MRI of the abdomen, or you can do a DEXA scan. But most of the time it is not indicated, because first of all, it is costly, it's not always available, and it entails lots of radiation, especially for CT scan and DEXA scan. So for day-to-day purpose, you can always assess your abdominal obesity by checking your waist circumference as well as checking your waist hip ratio. So having known that belly fat is extremely dangerous to cause premature heart disease, and how to assess belly fat, and how belly fat causes heart disease, premature heart disease, now you should know how to prevent it. And for the prevention of belly fat, you have to take lifestyle measures. There is no medication for that. Few simple lifestyles if you undergo, the belly fat will disappear. Although belly fat will take a long time to go, because it is quite resistant. So first and foremost is that walking. Very commonly we tend to ignore this simple exercise. Walking is one of the most powerful exercise. At least walk 7 to 10,000 steps per day, distributed over the whole day. So you should go for a morning walk, it's very good. But not only morning walk or evening walk, all throughout the day, you should be active as much as possible. Nowadays, you can track your steps through various wrist watches and other gadgets. So try to take at least 7 to 10,000 steps per day, and especially try to walk immediately after taking meal. That we have discussed in other videos also. Immediately after taking meal, if you walk for at least 10 to 15 minutes, your blood sugar becomes normalized. You do not have a significant blood sugar spike. So walking is one of the most important aspect of taking care of your belly fat. Second important aspect is resistance training. After 30, with passing of each decade, we tend to lose our muscle mass around 5 to 10% after 30 years of age. And muscle mass is very important, because muscle is a very active fat burner. The more muscle you have, it tends to burn fat more efficiently. And as we age, we tend to lose muscle. So unless and until we do resistance training, that means active weight bearing training, we won't maintain our muscle mass. And if you don't maintain our muscle mass, we won't burn fat as efficient. Aerobic exercise, that means walking, jogging, swimming is definitely important. But along with that, at least twice in a week, you should do some strength training activity as well. So apart from this exercise, diet also plays a very important role. You should include fiber in your diet, include lots of green leafy vegetables and other whole grains in your diet. There should be adequate fiber in your diets. Most important in your diet, to avoid sugar and sugary food, especially liquid sugar like your fruit juice or sodas, colas, ice creams. All these liquid sugars should be avoided, and sweets and simple carbohydrates should be avoided. Rather than taking simple carbohydrate, you take complex carbohydrate. So like simple carbohydrate, in case of grain, it is like white rice or wheat based product. So rather than taking a white rice or wheat based product, you switch over to a more complex carbohydrate, like you can take steel cut oats, or you can take millets, you can take dalia. So all those things falls under that, or you can take quinoa. All this falls under the category of complex carbohydrate. So avoid sugar and sugary food, take more of a complex carbohydrate in the form of whole grain as well as fruits and vegetables. Sleep and stress reduction are very commonly underrated. They are also very important as far as stress, as far as weight management and visceral fat and belly fat management is concerned, because the more stressed you are, you will have more cortisol in your blood. And cortisol, the higher the cortisol in our body, cortisol accumulates the fat, especially in your abdominal region. So you need to reduce your cortisol. How do you reduce your cortisol? By engaging in stress reduction activity like yoga, pranayam, exercises, having a good peaceful night's sleep, which decreases your cortisol level, decreases inflammation, decreases your belly fat. And last but not the least, you follow the plate method, where you are discussed in other videos as well. In plate method, in your plate, 50% of your plate should be of green leafy vegetables and salads. 25% should be protein, good quality protein like fish, egg, chicken, paneer, mushrooms, dals, all those good source of protein, and 25% only should be the whole grains. So if you follow all these things, if you exercise regularly, do resistance exercise, do stress reduction, have a good night's sleep, follow the plate method, avoid refined sugar and sweet products, especially liquid sugar, and go for whole grains, have a good night's sleep, you will develop a healthy diet, healthy lifestyle, and your body fat will decrease, especially your belly fat will come down. And by decreasing the belly fat, you will significantly reduce your risk of a premature heart attack or premature stroke. So key takeaway in today's presentation is that heart disease and heart attack are very common, especially in South Asians, because they tend to develop the dangerous belly fat or visceral fat as compared to the Western counterpart. And this belly fat, although they are dangerous, but it can be taken care of. You should assess your belly fat by checking your waist circumference and checking your waist hip ratio, and you should have your lifestyle intervention, as we have discussed, to decrease your belly fat or keep it under control. So if you like our video, kindly look into our other videos which we talk about how to decrease your blood sugar by employing all these simple hacks. Thank you for your patient hearing, and do like and subscribe to our channel.